Yes. So there are no cures or immunization for or against CHIKV. There are only preventive measures that can be taken, and for the disease not happening again, or the virus, I should say, not happening again. And these preventive measures, including they were individuals or note warned to wear light clothes, light long sleeve clothes, cover as much of their body as possible. Um, to alleviate the symptoms, they were given painkillers, but there were also a warning against using medications such as ibuprofen or aspirin, and this was due to the link that it has an increased risk of bleeding. So individuals were warned with regards to taking high dosages of those types of medication. Um, so some of the other measures that were taken to prevent the disease were individuals were cautioned to use repellents as well as using mosquito coils. I'm not sure a lot of people know what that is, but it's this coil that burns, and it burns and it keeps the mosquito away from the home or from the area that you're located. Also, they recommended electric vapor mats can be used both day and nighttime. Individuals were encouraged to use mosquito nets as well as window screens if they're going to have the windows open, to use the window screens. Um, for outside of the home, individuals were warned to, in their homes, to clean areas where standing water was. And I think this was one of the causes of um, areas such as Montego Bay, because they have a lot of water section that's just standing, and it's just like not clean, not sanitary, is overpopulated. So these were some of possible causes that was linked. But the recommendation were like if you had water like in barrels or in like tanks, to make sure that it's covered, to clean the area, and just have no water standing that's not sanitary. Um, Also, the government also sprayed um, insecticides. So they use vans to drive around and just spray areas that were highly affected, or even ones that were like affected on a lower level. They would drive around and spray the areas, just to kill the mosquitoes that were living, as well as the eggs that were like forming. So those were the caution and the preventive measures that were taken. Um, the unfortunate thing about it is there hasn't been any, I would say, finances that has been geared towards reducing the incidence of chickpea coming back. There were no changes to as of date. There were no changes with regards to plans for a virus outbreak as such again. Um, the It's just preventive measure. They caution with regards to when they're having like rain season, to caution about having mosquito because of the fear of like dengue fever coming back. So those were the measures that were truly taken. I think that Jamaicans have learned from this outbreak, because they continue to have like days of cleaning. They implement cleaning days where they would just go and clean, like, I'm trying to find the word. They It's like standing places. In Jamaica they call it gully. So a gully is like a barren area that people like throw like water bottles in and stuff like that. So it's like a area where sometimes water comes, sometimes it don't. So they have days of cleaning where they would implement such things as that. So I think that's also some of the things that has changed and improved, and there hasn't been any outbreak of such form since then. My references will be noted in my paper. So thank you very much. If you have any questions, feel free to ask, and I will be responding and reading for comments. Okay, thank you. Bye bye.